This is the strategic plan for McKesson in gaining market share in EHR. A four corners analysis was performed to evaluate our organization. McKesson is the nation's leading healthcare company, which continues to grow on a global scale. Our mission is to advance the status of our current healthcare system by enhancing the success of our customers and partners. McKesson utilizes its I-CARE principles to promote strong values including integrity, customer first, accountability, respect, and excellence. Our company prioritizes development within our country. McKesson strives to improve its software installation rate of 70% in our nation's hospitals with over 200 beds. We believe in uniting clinical expertise, technology, and our resources to change the cost and improve the quality of our healthcare system. Our provider technology segment delivers enterprise-wide patient care, clinical, financial, supply chain, managed care, and strategic management software solutions. Our company continues to outsource other services to healthcare organizations throughout North America, the UK, and other European countries, which will strengthen our global community.
We pride ourselves on being the gold standard for the industry. We provide the highest level of quality and efficiency to our customers. As a result, 18 McKesson products in 18 categories are rated in the top 3 of their respective categories. We also have a competitive and cost advantage over other healthcare organizations in the industry. McKesson helps healthcare providers to deliver safer, more effective care while eliminating unnecessary costs. In addition, we take a cautious yet aggressive approach to decision-making due to having more than 175 years of experience within the healthcare industry. Our industry assumptions include the notion that process improvement will drive the buyer. We also believe that in regards to the short term, many decisions will be frozen regarding healthcare IT until they are sure standards and reimbursement policies are established and set for the industry.
Capabilities. McKesson has many strengths. A few key strengths are outlined here. McKesson has had increasing revenue steadily since FY05. This has allowed McKesson to invest in innovative IT solutions to expand market share. McKesson also utilizes Six Sigma. This has transformed the business from function-oriented to process-oriented and has achieved more than $100 million in internal savings and has improved customer service and service capabilities. McKesson was also a KLAS winner in 3 major areas where potential for high growth exists. KLAS rates EHR products to provide accurate, honest, and impartial vendor performance information. No analysis would be complete without trying to identify some of McKesson's weaknesses. In 2008, McKesson derived 97% of its revenue from its distribution business segment. That includes the prescription drugs, medical surgical supplies and equipment, and health and beauty care products throughout North America. The IT sector of McKesson is profitable, but is not the bread and butter of the company. As changes in pharmaceutical pricing and payment models required by CMS come about, this could hurt McKesson's earnings. Another weakness is that McKesson does not have a deep relationship with government agencies and contractors. If we are moving towards a single-payer system, McKesson is a bit exposed as a result of a weak relationship with the U.S. government.
McKesson's current strategy is one that uses innovation, technology, process knowledge, and lasting value-driven approaches to create relationships with its customers and suppliers. Upon providing comprehensive solutions, its business distribution and IT solution segments allow for growing acquisition, enterprise solutions, and heavy R&D expenditure. McKesson's principles are simply stated by I-CARE, which allow for efficient function locally and across seas. Finally, by using an infotech feature, a wide range of software and hardware for healthcare organizations are already proving effective in producing better results from a quality and cost perspective. So where does McKesson want to go next?
This strategic plan is meant to cover a 3-year horizon. We believe that frozen decisions and a bit of chaos is going to reign in this time frame, however, as details of healthcare reform evolve, roll out, and are inevitably delayed. In the meantime, providers and payers alike will remain financially stressed. A recent survey of hospital executives report real concern about hospital financials. Fortunately, McKesson's market position as the leader in achieving internal savings through process improvement can be capitalized on. Decisions we make during this 3-year period will be done with an eye towards the future and beyond. We have added value in strategic acquisitions, and we're going to now turn our attention to alliances, partnerships, leadership changes to accomplish our goal of becoming the dominant HIT provider in the industry. Throughout this, we will mention 4 Ps. Ambitiously, we are going to touch on all these areas, although any one could be developed and it would still be insufficient in the timeline of this exercise. We're choosing to touch on all of them, however, because we feel that a multi-pronged strategy is important. Depending on one or a few product services or places in the market would just be short-sighted. To strengthen relationships with our core market by supporting programs in the places they go, the American College of Healthcare Executives, Chamber of Commerce, and perhaps the AHA. We're most excited about developing new applications for this market segment, though. The first will be with fundraising, something no other EHR provider has done. Secondly, and most exciting to us, is our Study Share product. This could be used in evidence-based design to cut down on that 17-year on average time that it takes to get providers to adopt a new procedure. That will help with pay for performance they're all concerned about. Last, we're going to implement new severity methodologies into our suite of services. We're going to hire Dr. Lemmy from Georgetown University to come up with some innovative ways that will make us unique in the marketplace. We are happy with our Relay Health product and relationship with Microsoft. We wish to continue this relationship. Additionally, we will cost-effectively sell this service on highly targeted special interest group websites. We believe the consumer most likely to keep a PHR is highly educated or has a chronic disease which spurs him or her to manage their records. So we will partner with disease management websites, for example, diabetes or lupus, to reach the latter group. A link will take the browser to our product site. Likewise, we will target those consumers most likely to want and keep private records by partnering with websites for estate planning, tax planning, and self-directed IRAs and HSAs. We believe this will be a cost-effective way to market our product to those most likely to keep a PHR. We will also leverage our work with Geisinger and others who are leading the way in medical home. Medical home will grow and provides a model for patients to have access to their records with an assurance of completeness and security. While we continue our current efforts in the physician marketplace, we're going to also concentrate in a new area. That's the broadband build-out to the rural areas that the FCC, USDA, and Commerce Department are doing. There's healthcare IT money that's been set aside for that, and we intend to be one of the partners in the trials.
But what about the government?
When are they going to give it to us?
McKesson's core competencies lend themselves to much of the government work at DoD and within HHS. These contracts will grow and increase. A large project is underway currently with the single record initiative between DoD and the VA. While McKesson has government contracts, this has not been a strong area of focus. We feel that the board's expertise would be enhanced with the addition of a board member with government contract and/or military experience. Additionally, McKesson would benefit from hiring sales and other management with federal contracting expertise. Perhaps HealthNet, with the change in TRICARE operations, represents a target for recruiting. Partnering with an Ingenix, Northrop Grumman, or even a Booz Allen might provide entree to this lucrative market. We have a smoothly working business partner model, but we feel we can enhance it by learning from the IBM model Rich Hume is running, where fully 30% of their global revenue involves a partner. In our industry, there are over 200 startup and emerging companies, generally built on one or two specialty applications. Like Apple has done with the iPod and IBM has done with their business partners, we can open our products and services to the addition of a specialty application where it makes sense. We will allow them to bundle it in with our package and sell it in their market. We will also bundle simplified elements of our products together, as IBM does for sell by business partners, possibly allowing them to rebrand it. As IBM does, we will pay attention to the angel investor and startup investors to get in on the ground floor of new application acquisition where it makes sense. We will grow our global business with business partners where the Joint Commission and others are experiencing high growth. We'll leave you with some final thoughts going beyond the 3 years. We do feel that strategic hiring and board appointments will be important for McKesson, in addition, of course, to maintaining our excellent gold standard product mix. We do think that this is a fragmented industry and a big merger is likely to happen. We intend to be the person who will buy, acquire, partner with someone else, and become the dominant player in this industry.